After I came to Auburn, I wanted to create a class to teach about animal-assisted therapy and the effects they have on people in different situations. We created the class in 2010, and the initial class had 8 students in it. Over the years, it grew very fast. Because of that growth, every student could not get a clinical experience in a nursing home or in a hospital. And so the simulation was created to give an experience for those students to have a clinical situation without leaving the School of Nursing, without having to go to the hospital, and we could serve more students by doing that.
So we divide the students into pairs where one group would act as a simulation for a hospital visit and one group would go into the home health suite room to simulate a home health experience. One acts as a patient, the other will try to position the dog in a way that they can be petted, interact with the patient, just simulating the entire experience. After about 10 minutes, the faculty in the simulation control room, as well as the other students that are watching, will come out and we will have a discussion piece. So some things to think about would be, where can I sit in somebody's home? Am I allowed to sit in this chair? How do I get the dog positioned between the furniture? Again, talking all through that.
It's been really cool to learn about the benefit of animal-assisted therapy and the benefit that that can provide to your patients, whether it's an inpatient thing or they're outpatient at a doctor's appointment, just relieving stress and making patients feel more comfortable. The interaction between the dogs and humans, whether it be nursing students or a patient, and just kind of learning about all the different ways that they're trained for animal-assisted therapy and the benefit that can provide to patients and students and just all humans.
It really allows us to have the opportunity to have an experience that we wouldn't necessarily always be guaranteed at the hospital. And it also allows us to be able to think on our feet. And it's beneficial for the patients too because we have a more well-rounded education. It allows us to have more of a holistic experience in working with patients because we're better able to not just focus on the pain, their condition, why they're there, why they're hurting, what they want. We can kind of see them as like the whole entire patient together.
So much in nursing school we learn about IVs, we learn about how to draw blood and take blood pressure, but we don't always get to learn about what else that they can do to help heal patients. We are able to witness and learn about how animal-assisted therapy comes about and how to train the animals and the impact that it can have on the patients and the family members in the hospital settings.